The special population I chose was homeless individuals, and specifically those that are in the state of Colorado. Having lived in Florida almost all my life and seeing a lot of homeless individuals over the years, I was amazed when I lived in Colorado at what seemed to be a greater number of homeless living there compared to Florida. This baffled me, especially the amount still living there during the winter season. Throughout this presentation, I'm going to give you some background information, predisposing characteristics, enabling characteristics, and need characteristics on this specific special population, and concluding with why it is important that we care. According to the United States Department of Housing and Urban Development, Colorado's homeless population increased 13% from 2015 to 2016, even though the national average on homelessness had declined by 3% during the same period. Some people blame the legalization of marijuana, while others blame a housing crisis. The economy in Denver is booming, and unemployment rates keep declining, and there is not enough housing for the amount of people moving to the city. Recently, to combat the homelessness problem, the state of Colorado started to enforce its urban camping ban policy by ticketing offenders and throwing away tents and supplies found on the streets. The homeless population varies in demographics. The homeless population is comprised of 63% men, 37% women, 22% are children, 35% families, and 14% veterans. Homeless women, like the one pictured above, face the most difficulties. The economic standing of women is worse off than men. Women face more gender issues compared to homeless men as well. This includes child care responsibilities, pregnancy issues, menstrual problems and needs, wage gaps, job discrimination, and family violence. The low wages and poverty of women is a predisposing characteristic of homelessness. In a study done by J.L. Jaskin, 1 in 4 homeless women stated that their homelessness was a result of some form of violence against them. The largest amounts of homeless individuals in Colorado are living in developed urban areas. The most prominent area where homeless individuals are being seen is in Denver. Denver is where the most hospitals and outpatient services are located within the state. The most well-known health center for homeless individuals in Colorado is the Coalition for the Homeless, who serve the Denver population. They provide primary care, behavioral health care, pediatrics, dental care, vision care, pharmacy services, as well as health outreach programs. In 2015, they served over 15,000 individuals regardless if they could pay or not. According to the City and County Center for Denver, this is one out of over 75 organizations in the Denver area that help with the homeless population. So why should we care as health administrators or for public health policies? This special population is at risk for untreated acute and chronic medical, mental health, and substance abuse problems. This includes, but is not limited to, overconsumption of alcohol, illegal drug use, which results in overdoses, extensive walking problems due to no shoes or poorly fitting shoes, and major malnutrition problems. According to our book, homeless individuals each have 8 to 9 medical conditions or illnesses. This is concerning for surrounding hospitals to be able to accommodate these individuals who usually are uninsured or do not have money to pay for services from an administration standpoint. But also from a public health standpoint, homeless have greater chances of being exposed to illnesses due to overcrowding and spreading in shelters. Another concerning risk is HIV. According to our book, HIV and AIDS are need characteristics of vulnerability. As I mentioned earlier, women account for a large portion of the homeless population. We have seen in class that women are the fastest population affected by AIDS, which in turn means they are more predisposed to HIV. Another thing that contributes to this is substance abuse problems, as mentioned before. This causes individuals to be at higher risk for HIV from sharing needles. There was a study done in Denver that concluded homeless population in this region were at high risk for HIV infection and targeted interventions are necessary. Lastly, I'm going to go over potential barriers to health care for homeless individuals. One huge barrier to health care is the access to transportation for homeless individuals to even go see a doctor or go to the emergency room. And even if they do go see a doctor, they lack sanitation necessary for medical care and the funds and storage to keep up on medical prescriptions. In Chapter 11, we see that the homeless face barriers to ambulatory services but incur high hospitalization services. The cost for this is usually individual predisposing factors and system factors. Efforts by the federal government to aid in these barriers includes the Healthcare for the Homeless program, the McKinney Homeless Assistance Act, the Mental Health Services for the Homeless Block Grant Program, and federally funded community health centers. Another government-funded program that we are all familiar with is the Veterans Affairs Department. All of these programs address case management services, substance abuse services, and mental health services. Here are some discussion questions to think about. Thank you so much for listening to my video today.